Dr. Jennifer Fletcher, I thought I was going to find you at this big vet clinic in Harrisburg, Pennsylvania, but you've gone down the road, madam, and have
Yes.
your own practice for canine rehabilitation and pain, Paws in Motion. That's a bold move,
It
right?
is,
And
it
that's
is.
brave.
It's a leap of faith. We're the first practice in central Pennsylvania to be solely rehabilitation and pain management based. So,
Wow. That's really great. I think one of the things lacking in human medicine is pain clinics. There's
yes,
fly by night places, I think, in strip malls. I don't know
right,
that for sure, or I don't
right.
know what they do exactly. But a really good pain clinic, sometimes they're attached to a teaching university hospital in human medicine. Isn't it pretty rare? I know only know of one canine rehabilitation pain person who does it in Colorado. For the East Coast, you're pretty rare.
Yeah, there's a lot of rehab places, but the fact that we also offer the pain management aspect, I think makes us unique because I think a lot of owners just they're like, my dog doesn't need rehab. My dog's in pain.
Right,
Great. That's what I do too. And
right.
that's part of what I preach is get rid of the pain. So
So, one of the ways that I met you is because I'm a big fan of Synovitin, especially in the case of where you are. It's a one injection that lasts up to a year. So,
mhm.
even though someone thinks Harrisburg, Pennsylvania isn't around the corner from me wherever I am, but it would be worth a trip because if it works as well as the science shows that it works, who wouldn't want that instead of weekly laser, weekly acupuncture? Not to say you couldn't do those things as well,
Right.
but the adequate injection, the various other things that kind of feel like band-aids. You've been using Synovitin quite a while and you used it on your own dog.
Yes, correct. I did
Did
twice.
you did you twice? Did you start with
Mhm.
him to make sure that you were comfortable using it and felt confident about it, or was did you come to him after you had all the hallelujah moments with the clients?
I treated him about 18 months after I started when I introduced it into my practice because that's when I discovered his arthritis. But so yeah, I had treated mostly elbows with the product, which is
Hmm.
what it's studied, the data shows and what it's studied in. But he was one of the first dogs I treated hips with.
Wow. What breed is he?
He is a mix of a Great Pyrenees and an Anatolian Shepherd.
That is one big hairy dog.
He is 115 pounds of love. Yes.
Nice combination. I mean,
Yep.
both those dogs can be fierce guard dogs. In other cultures, they're
Yep.
fierce. I mean,
Yeah.
we look at a Doberman or perhaps a Rottweiler and think, ooh, that could be scary. And
Yep.
we go, oh, Great Pyrenees, they look like the
They take
Saint
it.
Bernard from Peter Pan. But in some
Yep.
countries where they're
Yeah.
used to guard the flock, they
Yeah.
say,
Don't.
don't come
Yeah.
any closer.
Yeah. Don't walk into my house
Yeah,
unannounced. I don't
yeah.
recommend it.
And,
So,
and Anatolian Shepherds, similarly, they're so
yes.
beautiful.
Yes. Yes. And combine those two together, and you have one dog who loves to make sure my kids are safe. So,
Oh, that's really nice. But do they get hip problems the way German Shepherds do, or was he more of a one-off?
no, they are known to get hip dysplasia and hip arthritis secondarily. So, yeah, it's not uncommon. I don't see many Pyrenees and Anatolian Shepherds in my practice just because not many people have that
That's
breed.
right.
And but when I do, they've definitely had knee problems and hip problems be their majority of their issues.
Were those just a secondary pet peeve of mine? Do you think those dogs were spayed or neutered before 2 years of age? The ones with the
No,
joint
not
problems?
necessarily. No, I've seen them
Oh,
intact because they are livestock guardian dogs, since they tend to keep them intact. So I have
right.
seen it in intact animals as well. Yep.
It's just such a giant breed, fully a
Yes.
giant breed, that it's going to be prone to it. So you
Hmm.
said when you found arthritis in him, I think one of the things that we talked briefly before we started bugs both of us is people who have dogs in sometimes a really significant amount of pain. And the people are like, oh, no, he's just stiff. He's old. That's just what he's like. It's okay. He's slowing down. When the dog is screaming pain, really, but covering it up.
Yeah.
How, when you said you found his arthritis, how do people go about discovering if there is something treatable in their dog who's creaky, let's say?
Yeah. Yeah, the first thing is recognition and voicing that to their veterinarians. A lot of people think it's just age related, slowing down, but they don't know they're 8 years of age. They don't know they're 10 years of age. And so why are they slowing down? They're slowing down because they're in pain, because they
Yep.
hurt and they don't want to move that quickly. So The first thing is recognizing that dogs don't voice chronic pain like they voice acute pain. People are like, they're not crying out. They're not going to do that. You stub your toe, you cry out for a
A
second, and
second,
then you
yeah.
move on. Chronic pain is you slowly get out of your chair. That's what a
Hmm.
dog's going to do. They're going to slowly get up, or they're not going to get up anymore when you walk into the house. And that's what we
Yes.
noticed with Murray. He was even if
Oh,
we walked into the house, he would immediately jump up and bark his head off at us and then
nice.
realize who we were. So when he was struggling to get up and it was getting slower, and we're like, you're only 6,
Yeah.
there's something going on, time to get x-rays. So that's how we recognized his pain, because otherwise he's running around my backyard chasing the FedEx man.
Who foolishly entered the backyard.
Correct. How dare he?
It's one of the things that people should also think about eliminating as a possibility, depressing and frightening as it is. What if one of these larger breeds has long bone cancer? What if they have osteosarcoma? That could be another reason for limping at the very least, if not slowing down.
Mhm.
And that can be found out in the same way as arthritis.
Absolutely. Absolutely. X-rays are our baseline diagnostic. I am probably the most aggressive clinician in my practice to take an X-ray first to rule out
Yeah.
underlying cancer and to determine osteoarthritis versus soft tissue as well. And so
Yes.
it's super important. There's a lot of dogs with soft tissue injuries secondary to, in the front end, secondary to hind end problems, and they're getting diagnosed as arthritis. And you got to prove that through an X-ray.
That's interesting because in horses, lameness for performance horses is not uncommon and something that everybody's, always like a hawk. Where's he hurting? Is it the
Hmm.
front fetlock? Is it his rear hock? And in
Hmm.
fact, that the shifting, if there's pain in the back, you shift to the front and vice versa. And dogs do that too?
Dogs do that too. So it's ironic how the dog will present 8 to 10 years of age to me for a forelimb lameness because their head's bobbing up and down. It's
Yes.
very noticeable to the owner. And I'll do the x-rays on the front end, see nothing osteoarthritis wise, bone cancer. I rule everything out. My exam's telling me there's some more soft tissue stuff going. So then I switch my x-rays and I x-ray the back half of the dog and I unearth the hip arthritis. I unearth the lumbosacral disease. That's going to stem a lot of forelimb problems, but it's the forelimb lameness that brought the dog in, not the fact that it's had hip arthritis
Right.
for 6 years. So
But you're pretty glad somebody came in at all. Because
yes, I'm
then you
always
can
glad.
do yeah, because then you can do something.
Yeah.
Otherwise, if it's way down the road, arthritis is a cumulative disease, obviously, and
Yep.
if there's ways to halt it, does that injection to the joint halt the arthritis if that was the underlying cause?
So there's evidence right now that it can decrease the progression. So they've done a study in rats that have shown like 50% of the time it's shown to slow the progression of osteoarthritis. And that would, there's a class of medications, or at least this is a device, not a drug, but if it can be disease modifying, that's an exceptional label to have as a drug company, as an
Yeah,
osteoarthritis
yeah,
management company. So they're not there yet, the dog level, but there's some showing some promise in other animal models that this could potentially modify the disease in the joint. And yes, we know that osteoarthritis is permanent, progressive
yeah,
disease.
yeah.
The joint is an organ, as I've heard it described by one of my
Oh,
colleagues.
interesting.
Let's call it an organ. We talk about heart failure, we talk about kidney failure. Osteoarthritis is joint failure.
Oh my. What an
So,
interesting idea to think of it as
yeah,
its own entity in a way. You refer to Synovitin as a device, not a drug, because it's injected. Is that the proper terminology for injectables?
it is. It is. It goes through a different processing through the FDA as far as clearances go. So it is, since it is not systemic, it is considered a device.
Oh, because it just works in that area.
Correct.
It only helps that organ, if you will, which is
Correct.
obviously one of the beauties of it. If you're
Correct.
giving anti-inflammatory by mouth, which in theory, but I don't think it's ever been proven in humans or in animals, it reduces the pain of arthritis, but it doesn't really reduce the arthritis, I don't
It
think.
reduces the inflammation, so it is a COX-2 inhibitor, so it does eliminate what that enzyme cascade will produce. Obviously, with osteoarthritis, it is an inflammatory soup. So it gets
Right.
one area of inflammation, it's not getting all areas of inflammation, and that's what makes Synovitin different. it attacks the inflammatory cell, which produces all of those inflammatory signals that perpetuate the osteoarthritis. And so it's essentially getting it right at its source rather than treating it lower down the inflammatory cascade.
How often, speaking of early, how often do people bring in a younger dog and you say, "Oh my, I've got the magic bullet," because the dog's four, and maybe it's an agility competitor, maybe it's somebody with a dog where they're paying, like a performance horse, so much attention to its
Mhm.
physical wellness that they do notice it and come into a rehab doc like you.
I would say I don't see them early enough most of the
Yeah.
time. Probably the hardest thing about being a vet is I see a lot of end stage arthritis because dogs manifest their pain differently than how people think they should or they would. And so but yes, the younger dogs I see tend to be the labs with elbow dysplasia because the forelimb lameness turns into a head bob and it's very obvious that the dog is lame, or the agility dogs, the sport dogs, the working dogs. So
Yeah.
yes, I will tend to see them younger because those owners and handlers are going to see the performance change in that very quickly.
Elbow dysplasia is how synovitin was developed. I didn't realize that.
Yeah, so as first, it's been studied in elbows. That's when the original studies. There are ongoing studies in other joints right now that haven't been completed, but yes, it was originally studied in the elbow.
I had a dog I had to put to sleep eventually. Now he was 13, but his elbows stuck out to the side like chicken wings. The elbow dysplasia was so severe, and there wasn't a treatment that I was told about anyway. It looked to me like he should have elbow replacements, but there isn't such a thing, is there?
There is.
There wasn't
Elbow,
then.
not
There
now, yeah,
wasn't
now it
then.
is. Yeah, not that it's inexpensive, but yes, it's yeah, I think it's joint injections, particularly for elbows, which are one of the hardest joints to treat as far as osteoarthritis goes. It's a very complicated joint.
Yeah.
Once the disease is there, you get bony changes that just change the gait so dramatically. The earlier we can get to an elbow, the better off that elbow will be, but it's never going to be perfect. But
Right.
I would love to see elbows as early as possible to try to prevent that bulldog sort of
Yeah.
stance that they're trying to unweight their
Yeah.
elbows. And
That,
then secondary to elbow problems, dogs develop shoulder tendinopathies. So there's so
wow.
the elbow and the shoulder are so closely related that once you have disease in the elbow, then the shoulder starts to compensate, and then you get into this wicked cycle of pain and overuse of muscles, and then you need people like me.
Yeah. That's the living example of a hot mess,
Yeah, yes, I
because it
agree.
really is a hot mess. So somebody comes into Paws in Motion and has a middle-aged dog, not an older one. Say it's a large breed dog and he's 5. I guess we could call that middle-aged. And they think something's not quite right. So what you would do is various body parts x-ray first of all. Of course you do a physical exam and you watch them walk and trot.
Yes, yes. So if there's one thing my rehab training has taught me is to trust your hands. My palpation
Yeah.
skills got so much better after going through that certification. So yeah, first let's try to focus on maybe localizing where the problem is. And then yes, next step is going to be x-rays to get really good views. I usually do them sedated, which isn't always the most fun part for me or for the owner or for the dog, but one, it's less stress on the dog, and two, I'm going to get diagnostic views. You can have a slightly tilted joint on an x-ray and miss a diagnosis or overdiagnose something. So it's really important to get really good views.
Because when the dog's loosey goosey, they aren't guarding. They're not using
Correct.
their muscles to resist you. Is that right?
Correct. Correct. And I see plenty of 100-pound plus dogs that can definitely say no if they don't want to
Yeah.
do something.
Yeah.
So yeah.
Because it's already hurting and you
Yeah,
want to extend it a little bit. You don't want to cause them agony, but you want to
correct.
extend it a little bit. And they're like, no, I can't. I can't do
Yep.
it. Dr. Jennifer, this is just not going to work for me.
Yep.
What about the spine? Is that any place that synovitin can be used? Because you hear about, I had a dog with a bulging disc and a ruptured disc or something. And I don't know, I went to a neurologist and his
Mhm.
idea, which I'm telling you, with an 80-pound Weimaraner, can't believe this is something someone would do. He said, "Oh, just last week, somebody with a Weim did this. We're going to fuse the vertebrae in the neck, and now the dog can only walk on a leash for the rest of their life. However, a sharp tug on the leash and they'll be paralyzed." I'm like, I'm sorry, what about this picture seems like a good idea for a dog that runs free? But
Right.
what do you do about discs? Or discs I think are probably underdiagnosed. People think of the legs and not so much the spine.
Yeah, so spine with synovitin isn't really a thing yet.
Okay.
I think the spine is so different because what we're working on with synovitin is the synovial joint. We are looking to treat the inflammation that are the macrophages and then also that integrate into the joint lining. So we need something that has a synovial
I
membrane,
see.
which there are synovial membranes in the spine. It's the articular facets. So it's the top part of the junctions of the vertebral bodies that have that. Maybe someday we could be doing injections on those. Those would have to probably be ultrasound guided, but
I was going to say that to get in exactly the right
to get in the
place.
exact way. But yeah, so there's potential for articular facet injections or potentially maybe sacroiliac because there could be potential there. But as far as spinal cord, that's where we reserve things like epidural steroids and things like that,
Ah,
which is something I've been doing for about a couple years now.
really? So I could have done that with you in
You
theory,
could
or
have, yeah, yeah. If it were, I tend to do it for more of the painful dogs, not necessarily more of the neurological dogs. So it's kind of on where the level is at. But yeah, epidural steroids can certainly help relieve some of this pain that they have in their spine.
and one of the indications is the not being comfortable getting up and down off of things, right?
Yeah, it would have to. I prefer an MRI as a diagnosis for intervertebral disc disease in dogs. It makes me feel more comfortable as to what I'm treating. But yes, they would certainly have difficulty rising, difficulty with stairs, and on palpation, they're very reactive when you hit the right spot.
It's like, oh, you got the spot. Back off.
Absolutely. Hmm.
So, do you have your own MRI machine in your brand new clinic?
I wish. No, we don't.
That would be unaffordable.
It would. It would. I do have some fantastic colleagues in the Philly area and Gaithersburg that are neurologists and board certified rehabilitation veterinarians that have MRIs. So I do refer out for those.
It's nice to have it. Now, again, have to say to people, which I've been saying until I'm blue in the face, if you get pet insurance from the moment a dog enters your family, can be a rehome dog or a shelter dog or a puppy,
Hmm.
then whatever crops up in any body part is covered. It's not a
Hmm.
pre-existing condition if it has not been documented by a doctor.
Correct.
Obviously people will sadly will try and do insurance fraud, wait
Hmm.
until the dog they've had for a while shows a symptom, then go to the doctor, and
Hmm.
then think they can get pet insurance. It's too late for all
Right.
pet insurance. This is not after the fact insurance, but
Right.
I will say that if an MRI costs 4 or 5 thousand, and I've had MRIs for some of my dogs for some conditions,
Yeah.
and you've opted for, let's say, $1,000 deductible for the year and 90% reimbursement, you're paying only 10%
Yes.
of that MRI, which
Mhm.
means that the doctor, like you, can get this really valuable information that can extend your dog's quality of life for years. In the case of dogs that are really crippled, extend their lifespan.
Absolutely. The correct diagnosis gives you the correct treatment. Shooting from the hip is hard. We do a lot of very well educated treatment plans without the MRI and things like that. And but if there's ever the dog's not improving, it's either the wrong diagnosis or it's the wrong treatment. We have to back up
Right.
and reassess.
And then you might lose the client's patience or trust. Or
Yeah,
not, or not. I don't know. What is that like for you? If you say, I think it's this, I wish I could have done X, but
mm,
it's not in your budget, and now
yeah,
Y didn't work. Can we try Z? Do they
yeah.
say, never mind? Or do they say, all right,
No, most people are very open to understanding that dogs can't talk. And I don't ever blame owners that who can't do MRIs. They're extremely expensive. They're
yep,
not close by to us by any means. So it involves a fair amount of travel, or the dog may not even be a candidate to get one for various other conditions that it may have because it
oh,
requires anesthesia. So if we get to that point where something isn't working and we need to reassess, I have that conversation from the get-go with owners. They can't talk. This is how I interpret what their exam's showing, what their x-rays are showing me. We can certainly take these steps. And if things aren't ever improving or worsening, or God forbid, then that's a conversation. You just let me know.
right.
And we're
Yeah.
going to try to find the right path. There's always other paths. We just need to be open in our conversation and our communication so that we're all on the same page.
That's
It's an
important.
art, not a science at this part when it
That's
comes to
that's
pain,
well said.
right?
Yeah, and the human relationship really matters because people can feel guilty they can't do more, or frustrated, or
Yeah.
angry that it costs so much, or embarrassed, or not
Mhm.
quite know how to say, or think that you might be making a lot of money and you want to make more money, which
Mhm.
is unfortunately a very broken idea that people have about vets. I mean, a
Absolutely.
lot of things cost a bunch of money. It doesn't necessarily go in the vet's pocket by any
Right.
means, but people think of it that way. But veterinarians are making a living. They're not
Yeah.
making a killing. I just like
Right.
to say that to people because,
They
we
should.
have this problem of not one more vet, of a lot of vets burning out and even self-harming because the stress and pressure of the human relationship
Yeah.
with owners is
Yeah.
hard.
It's
Hard to
it's
manage. You're trying to manage this dog situation. Now
mhm.
you've got a person crying and the other spouse saying, arguing about what should or shouldn't be done. It's tricky. And you
it
kind of have
it
to
is,
be
and
a
it's emotional.
psychologist. Yeah, very
Yes.
emotional,
Yeah,
right?
it is. It's emotional, and because they don't want to see their pets in pain. I don't
Yeah,
want to see their pets in pain. And so I'm as emotionally invested in my
yeah,
patients as the owners are. And so I get where they're coming from, and some people manifest their emotions differently,
that's
and
right.
it's part of the profession, but it's not the it's that's probably the hardest part.
Yeah, exactly. And you're often either a miracle worker or having to say, I did what I could, I think what I thought, and we aren't getting very far
Right.
because that's just the nature of it. What was the outcome with Murray, the giant guard dog, after Synovitin? Was it a miracle kind of
It
situation?
it was pretty phenomenal how he went from struggling to get up our back deck stairs, so it's a full flight, to it took about 4 to 6 weeks because it's not an overnight sort of treatment to
Right.
decrease inflammation. And he was just trucking up the steps again, greeting us at the door. It really was unreal how well it worked for him. And that was game changing for me as an owner and then as a veterinarian to be able to see the
Yeah.
difference in my own dog. And then it lasted for about 22 months. He was not on an
Wow.
anti-inflammatory drug for 22 months
Wow.
before we started seeing those signs creep up again, and I elected to do it again. And I've had a couple of owners elect to retreat with Synovitin when they started seeing the inflammation start to come back. And it just shows, they trusted me to know my faith in the product and their trust in me to treat their dogs again. But I was absolutely blown away. And to be able to, everyone wants that story, right?
Of
Like,
course they do. Yes.
what do you see in your own
What would you
patient?
do, doctor?
Yeah,
Yeah.
exactly. The what would you do
Yeah.
question, which is really hard to answer sometimes as a vet. And I'm like, I can tell you what I did.
Yeah.
And if this is feasible for you, then I think it's a really good option. It was, yeah, Murray was uncomfortable for a couple of days. Joint injections are certainly not exactly pain-free, but he was okay. And a couple of days later, he was back to himself. And then 4 weeks later, he was running around my backyard again.
That's pretty cool. And you said 22 months, almost 2 years. What it says is it will last about a year. So you
Up to
got two.
12 months, yeah, but
Yeah.
we're seeing a lot longer in many patients. Um, I think it depends on which joint you're treating. It depends on the level of arthritis that the patient has. Arthritis is very complicated. We can
Yeah.
only see what we see on an x-ray unless you're doing a scope and you can see the inside of the joint. But every dog's level of arthritis is different. And what we see on the x-rays doesn't always correlate to the level of pain in the patient. So
Right.
you got to interpret the dog in with your physical exam, my range of motion numbers that I get, and then the x-rays together and complete that whole picture.
Which is why being a rehab specialist and understanding that scale of wellness or illness helps inform what you give them and what you do for them. There
Right.
was another injectable that I had tried on another dog that was every month. So on the one hand, you could get an injectable, not in a joint, but
Mm-hmm.
intramuscularly,
Mm-hmm.
and you could get this great reaction.
Mm-hmm.
But then in my case, I never got it again. Go back
Okay.
month two, go back month three. She was back to where she was in the beginning. It was like a ta-da. Oh, and it sounds like this is really a game changer because it's almost a joint changer. It seems like it really changes something in the joint. It couldn't
Yeah.
last that long otherwise.
Yeah, I love that term, joint changer. That's exactly what it is because we're
Yeah,
treating the problem, which is the
yeah,
inflammation. Now, we can't get rid of the dysplasia that the dog
that's
has.
right.
That's the one thing we can't control. But if we can control what the inflammatory cells are doing in there, then we're going to decrease the pain because that's where the pain's coming from. So, I probably stole this adage from somebody else, but treat the joint, not the dog.
Ooh, I think that's interesting. So the joint is an organ. Treat the
Mhm.
joint, not the dog.
Dog to systemic. I'm not opposed
Yeah,
to systemic pain medications. I use them all the time, but
right.
if I have the ability to treat the joint and rather than the
Yeah,
dog, then I'd rather do
yeah,
that. I always want to treat the underlying problem. Like I
definitely.
said, you can treat a shoulder tendinopathy all day long, but if you're not controlling the pain in the
Yeah,
hind end that's causing the shoulder tendinopathy, you're
right.
not doing anything for the dog.
All you're going to do is see that person over and over, and at some point they're going to say, "Seriously?"
Yes, correct. Something's not right. Yeah.
Yeah.
So yes, treat
Well,
the
this
joint,
is
not the
this
dog.
is really amazing. I'm very happy for you that Paws in Motion is out in the world in Harrisburg, Pennsylvania. So anybody who has any of these issues or problems or questions, ask your vet about Paws in Motion and Jennifer Fletcher. They probably know her because she's pretty well known in the field, but most importantly, she might really be able to help your dog. Thank you so much, Dr. Fletcher. It's really been instructional, informational, and uplifting. I think what you're doing is terrific.
Thank you so much for having me. Appreciate it.